Well, new health warning for men. A new study suggesting prostate cancer is overtreated, and those treatments often have serious long-term side effects. Is this true? Here to weigh in on that, Dr. David Samadi is a member of the Fox News Medical A team and the chief of the Division of Robotics at Mount Sinai Hospital. And, Doc, we should also point out that you are one of the premier experts when it comes to prostate cancer and understanding how men can avoid it and prevent it and how to treat it. So what about this new study, sir?
It's a study that's coming from New England Journal of Medicine. They looked at about over 3,500 patients, followed them for about 15 years. And what they're finding out is that there are some side effects with surgical treatments and radiation. But most of this study is coming from early mid-90s, where at that time we were doing a lot of open surgeries for prostate cancer. Radiation was not as sophisticated. We didn't have all this intense modulated radiation therapy, etc. So you have to take it with a grain of salt. I can tell you that the answer to that question that you asked, there are certain times that treatment for prostate cancer, or we're over-treating it. The reason why sometimes there's over-treatment of prostate cancer, Kelly, is that we don't have a real diagnostic tools, meaning that you may have many different types of prostate cancers. You may have high risk, you may have moderate risk, or you may have low risks. So for moderate risk and high risk, of course, you have to treat it, because otherwise they're going to really die and metastasize. You still have about 30,000 men die from prostate cancer every year. The big question and debate comes in when you have a low-risk prostate cancer. Okay. Do we really watch them? Do we follow them with these PSAs, which, as we know, it's not a very sensitive test? Are we going to do more biopsies? And what kind of anxiety does it cause for the patients? The truth is that your doctor should be a detective, should really look at the history that you have, look at the PSAs, the rise of the PSAs, how many cores of biopsy are positive, and put it and say, look, I think this is a low risk, we'll watch it, or there's a risk of spread. And
but I got to ask you right there, because it's begging a question. How many doctors will literally take the time to be that detective for a patient who may have a low-risk prostate cancer situation? How do you keep following it, and how do you keep developing it? Or does it rely on the patient being his own detective and going back again and again saying, Doc, what's wrong?
I think you're bringing out really excellent points. And I think for viewers, people that are diagnosed with prostate cancer, you got to listen to this man next to me. What he told you is extremely important. You have to be your own doctor. You really have to search for the best and most experienced person for prostate cancer if you're dealing with prostate cancer. I think medicine has become very complicated. Yeah. And while medical doctors, family practitioners may know some, you want to go to the expert for prostate cancer, and these are the ones that can really dig out and dissect which ones is going to hurt you and which one we can watch. Ultimately, when it comes to surgery, you want to pick the most experienced doctor. You know, I'm the wrong guy. If you need a vasectomy or other things, I may not be doing them all the time, so I have to refer it to somebody else. When it comes to prostate cancer, my eyes, my brain, my thinking is all concentrated during the week with prostate cancer. So you lower the risks. Now, in this study, they talk about sexual dysfunction or incontinence. All of that has to do with the experience of your surgeon. The more you do, practice makes perfect, and the better the result is going to be. So find the most experienced doctor, whether it's radiation or surgery.
All right, you will be joining this lovely young lady to my left here, Jamie Colby, tomorrow morning for a house call, and you'll bring us more details.
We look forward to it.
Yep.